All right. So then, Ihama, Liza, Ebony, is there anything else you guys would like to kind of close off or parting words to us?
I'm gonna give Liza and then Ebony the mic to say some parting words. My specific question to you is, what would you like to leave the audience with today in terms of your work?
I would just like to say thank you again for inviting me to speak and share my journey in science as a woman. My biggest message to everyone is don't let your voice not be heard. Keep talking even when someone's talking over you, because they'll eventually listen to what you have to say and they'll realize that you are a powerful force to be reckoned with. So just believe in yourself.
Ebony, what about you? Thank you, Liza.
I like it. Liza just inspired me. I would agree with that. I definitely would say thank you again for having us on this call. What a privilege it is to be able to share with so many amazing people who are interested in science or pursuing science careers and wanting to help broaden our horizons and expand the doors. I definitely agree. We should continue to knock down doors and be yourself. You have something unique that you bring to the table. There's only one you. And if you are not you, then who will be? So we need you to do all that you can to help this world become a better place so that we can continue to serve and help each other in our communities.
Thank you, Ebony. Both you and Liza inspire me all the time. So, but I'm lucky enough to work with you, so I get to call that out. I just want to say thank you so much for having us. We really appreciate being here, and I really like all. I'm sure our contact information is available. You can check out the Gift of Hope website if you want to reach any of us. Our contact information is there. And I really want to encourage anyone who's interested in working in the OPO industry, whether it's at Gift of Hope or anywhere else around the country, to join, because it's a great place to be of service, but it's also, as we talked about, very science driven in many different areas and worthwhile for people who are interested in that world of work.
Thank you. Thank you guys so much for sharing all this wonderful information and parting words and all of that good jazz. Audience, if anyone's having difficulties connecting with any of our speakers today, feel free to reach out to me or any of my staff, and we can definitely help get you guys connected if there's any issues there. But again, thank you guys so much for your time today and sharing all of your wonderful wisdom and information. We're very fortunate to have you guys. But thank you. We'll go ahead and transition on to our next session. So just give me 1 second and I'll start pinning our next speaker. So our next session will be our public health career panel, Women Working in the Field of Public Health. So we've got some wonderful folks here. I'll go ahead and get them pinned on, and then I will go ahead and pass the floor on in just a moment. Okay. Hello, everybody. I appreciate everyone's patience. I'm just trying to find everyone, make sure we get them pinned on here. It's been very exciting, day 1 and now day 2. There we go, almost there. Okay, I think I got everybody on there. Okay, so again, it's just a friendly reminder for some Zoom etiquette. If you're new to joining the Zoom line, please remember to keep your audio muted during the panel discussion. Enter any comments or questions that you have in the chat. And then I will help kind of facilitate that at the end of the session too. But I'd love to at this time pass the floor on to our wonderful facilitator, Dr. Ejike. I'll go ahead and let you get us kicked off with the career panel today.
Okay, Alicia, nice to see you. I thought the other panel wasn't going to be done with their conversation, and it was a very rich and healthy conversation. Nice one. So welcome everyone to the second session. My name is Chika Ejike. I am an assistant professor in the Department of Health Sciences and Physical Education here at Northern Eastern Illinois University. So we actually have a rich panel of career public health professionals and some that have been in medicine and that are actually currently clinicians. So I would open the floor up to each and every one of our panelists to introduce themselves. So I see Colleen. Colleen, you can start if you want to, and then I would move it on to the next person. Okay. Colleen, you're muted. We can't hear you. Alicia, you're muted.
And now I was doing it. Oh goodness. Technology is so much fun. Colleen, if you want to check your audio settings in the Zoom, maybe it's just not connected to your computer audio. Maybe we wanted to start with Heidi and then we'll.
Okay, so let's move on to Heidi then. Let's move on to Heidi. If Heidi.
Can you hear me?
Yes, we can.
That's wonderful. All right. Hi, everyone. I'm really excited. Yeah, really excited to be here on the panel today. So I'm a toxicologist with Intertech. So basically, my job is to ensure safety of products, to make sure that there's not any toxicants in those products. And I specialize specifically in personal care products and home items. So as far as my background, I have a master's in public health from Northeastern Illinois University. And I also have a bachelor's in pharmacology and toxicology from UW-Madison. And I've been in the field for about 10 years. So hi, everyone.
Hi, Heidi. And I want to say this, Heidi was one of my students and she's an exceptional student. Let me just toot her horn a little bit. Okay.
Oh, thank you.
So moving on, let's hear from Susan.
Good morning. Can you hear me?
Yes.
Wonderful. I am really happy to be here at Women in Science with a focus on public health, which is near and dear to my heart. I am currently the Director of Midwifery Education at the George Washington University School of Nursing. I am developing a new nurse midwifery education program because we don't have enough midwives in this country, especially enough diverse midwives. And so we are developing an online program with a focus on diversity and a focus on community birth, where we know we can get some really good outcomes. I've been a nurse since 1976. My first job was labor and delivery because I didn't really like sick people. Then I became a midwife to be with families and help them with their births. And as I did that, I moved on to get my doctorate degree in public health because, as you know, the health of the nation rests on the health of the mothers and children. And so it is really near and dear to my heart.
Thank you, Susan. And let's hear from Colleen. Are you back? Can we hear you now, or should we move on to Sarai? Okay, let's hear from Sarai. Okay, Colleen, yes. Okay, we can.
Great. Do you hear an echo?
Yes, there is an echo, but all right, you're good.
Okay, great. So my name is Colleen Lamb, and I am a registered dietitian and have my master's in public health with Heidi from Northeastern Illinois University. I am a senior project manager at the Chicago Park District. So my role is really centered in parks as public health, and also working also different areas such as the community dietitian and then with the women and children program.
Okay, thank you. I think you have to, I think audio's on. Maybe that was why we were hearing the echo. I think there's a phone on and then your laptop or computer is on.
I got that.
Better? Okay, good. That's okay, cool. Maybe that was why we were hearing the echo. And then, And then last but not the least, let's hear from Sarai. Yes.
Saria.
Saria.
No problem. My name is Saria Lofton. I'm assistant professor at the College of Nursing in the University of Illinois in Chicago. My work, I'm a nurse by training in multiple clinical settings, but I focus on prevention in terms of food as medicine, utilizing that for Black women with hypertension and obesity. It's also with Black breast cancer survivors, which is how I'm branching out into the food as medicine work and looking at how the changes, what changes might occur in terms of biomarker related changes, inflammation related changes, metabolites from participating in a 12-week food as medicine program.
Okay, that's excellent. Okay, so now that we've heard from all our panelists, so we're going to move on to the questions, right? And audience, please feel free to drop a question in the chat, and then at the end, when we're done with questions to the panelists, then we can actually address your questions, okay? So feel free to drop your questions in the chat box. So first question for panelists. Now, mind you, this is women working in the field of public health. So we're going to discuss issues surrounding public health, career in public health, and other affiliated concerns. Okay, so the first question is, how does public health play a role in your career? So we've heard from different panelists, and they're in different, career parts. Some are toxicologists, some are nurses, career nurses, some are in public health as public health educators, assistant professors, and all that. So how does public health play a role in your career? Anyone want to take a stab at that?
I'm happy to start it off, given you can all hear me and we fixed the mute problem.
Yes.
In my role, really parks from the National Recreation and Parks Association, we're really looking at parks as community hubs to address public health. And the three main sources that I work with is food equity, physical activity, opportunities, and access. Also, in terms of nature and stress relief and mental health. Those are the three aspects from a public health standpoint that my role in the parks really focus on. And you can't do that alone. So you're looking at not only spaces being equitable and having access, but also who you're working with, so who are your stakeholders and your partners to be able to provide those specialty services. And that's really something. So programs, people, partnerships, and then also the policy to keep that in line. And that's really from a public health standpoint.
Okay. That's
I could go next.
Mm-hmm.
So really all facets of public health influence my job, which is why I was so interested in going back for my MPH. So for example, public health policy or regulations, those influence how products can be sold, how they can be transported, what kind of packaging they can be in. And they also, those policies can provide restrictions as far as like what ingredients are safe or restricted. And those are really to keep the public and the environment safe. So those definitely influence my day-to-day operations. Additionally, epidemiology, which is a huge part of public health, influences, how we understand what's safe and what levels are safe. So that definitely plays a key role. And of course, communication. If we can't communicate what's important to the public as far as safety goes and what they can do to stay healthy or what they need to avoid as far as products go, then we wouldn't be effective. So being able to communicate to a wide audience is something that definitely plays into my role.
That's good. That's really informative, Heidi. Yes.
I can go next. As a midwife, I had the pleasure and the gift of being with families when they're having their babies. And that's like an amazing experience, a humbling experience. But I realized that I needed a broader perspective, and often healthcare providers, such as midwives, nurses, physicians, focus on the one patient at a time that you're seeing. But I realized I needed to look beyond this because the maternity care system in the United States is absolutely broken. Even though people think we have the best one, we do spend the most money, but we are the only developing nation in the world that has a maternal mortality rate that is going up. And this is important for all of us to know, and a lot of people really don't know it. The latest statistics just came out, and in 2021, 1,205 women died. And that's up from 861 the year before, which means our rate of maternal mortality is 32.9 per 100,000 births. This is like a third world country. So I decided to pursue my doctorate in public health in order to look beyond the individualized care into the broader perspective. And as Heidi said, look at the epidemiology, look at the social determinants of health, and look for solutions. And quite honestly, all the things we've tried haven't worked very well. Our maternity care system is in a crisis, but we do know that birth centers and that type of care that is respectful and listens to the patients is very positive. And so we have to change the paradigm. We have to change the idea of birth in this country from fear and high tech to focused on the family and what they need, the community and what they need, especially with things like community birth centers. So like I said before, it's near and dear to my heart because I can, yes, be with one woman and help her family, but there are so many more that we need to pay attention to.
Susan, you make an excellent point. And you make an excellent point because you actually hit the nail on the head regarding being community focused and patient focused. So there should be this interplay between our focus as public health professionals on the community and what the families in the community need. And if the families need those birth centers, then we need to strategize to make those birth centers available to them in the community. And that's how we can actually be culturally competent in our communities. That's an excellent point you make, Susan. Soraya?
Saria,
Maria.
it's okay. So I would say Maria Saria. Okay. I would say public health. I think because my intersection with public health really came out as a school nurse. So I have always seen it as a way to connect with communities in a different way as a school nurse, because you're connecting with parents, children, and extended family, and then the school staff and administration at all times. So that was one of my first entrants after clinical practice into seeing how we could actually start to contextualize some of the messaging and things we're trying to say from the clinical side and actually infuse it in a way and disseminate in a way that's palatable to communities. So it's like integrated into the way that I think about the work that I do overall.
Right. So to piggyback on that, let's discuss how our academic experiences has led up to preparing us for our current career paths. So definitely some of us actually have bachelor's, master's, doctorate degrees. Our academic experience, our professional experiences, how has that led up or prepared us for the career we are in right now? How did it shape the career we are in right now?
I don't mind starting that one because I want to piggyback on what Heidi said about communication. My role as a nurse and a midwife is perfectly matched to the role of public health because midwives and nurses listen. They listen to the patient. They listen to the families. They put them at the center of care and they treat them as a partner in their care, not in a hierarchical manner. And so when you're talking to families and listening to them, then you can meet their needs. Well, that is exactly what public health is. We are listening to the needs. We are investigating. We're using our tools to learn about the needs of the community. But it's really essential to hear what they need. And I will keep coming back to community birth centers because this is a new movement that's happening. Midwives of color are going into communities in inner cities like Atlanta and Detroit and DC and building birth centers around the community so that the needs of the community are being met in those birth centers. And the excellent news is it is having an impact on outcomes. It is improving outcomes and is also definitely improving the equity in outcomes, improving outcomes for our minority populations who are really, Black women are 3 times more likely to die in childbirth than white women. So this idea of listening, the communication is critical. And I think mine, being a nurse and being a midwife, gave me those skills that I could build onto in public health.
Yes. Listening. If we can actually listen more, then we can be good strategists in actually implementing what our communities need. And we are actually after positive outcomes. That's the end goal. Colleen, you want to?
I thank you, Susan, because that is just it's so true. And from the experience, and the experience of working at women, infant, and children per se is that's how parks can be centered so well, is the park might not be able to offer it. And so when I worked at women, infant, and children, this is going to go into the next question a little bit, so I won't go too far, but I saw the difference of having healthy, nutritious food for women that may not have even had prenatal care. And 13 and 14-year-olds having children, when you look at that maternal health crisis that we are really in right now, making sure that they know the option of breastfeeding. And that is where being able to have that experience at women, infant, and children opened up, looking at parks in such a different way, because I think even the new generation coming up is, this is the job I'm going to do. Well, a lot of us were brought up with duties as assigned. And so taking that extra step to say that this is a place to breastfeed, right? Or this is where you can go to find your food at the WIC clinic. This is where the federally qualified health center is near a park. It's listening, and then also being a resource to say, I'll use Susan as an example. Did you know that down the street you can see Susan and get your prenatal care for free? Because I don't think that we listen and then talk and communicate with each other as health professionals in a very cross-sectional way of public health. So with that, it's looking at just say food in general, obviously for maternal health, pregnant, and then also with a mother, and then also for the infant, is that quality of food, and really pushing breastfeeding as that main source, but then growing into it. And then how are these youth getting food? And so not being prepared for the pandemic, because we didn't know, right? We're going to go back we're going to be back in school in 2 weeks. We're going to be back in person in 2 weeks. Little did we know that we are still in this crisis. But where were people getting food, and what was the quality of food they were getting? And so what I do want to say from experience is, how do we push health promotion publicly? As a public health professional, I feel looking back, we could have done so much better as a nation of saying, you're stuck in the house, this is how you prepare food, or these are the exercises you're supposed to be doing, because we're going to be looking at an obesity crisis right after that. And I don't think we've even touched the iceberg on that. So building our experiences is right now, we have to dig into our magic toolbox of everything we learned is reteaching us as humans what is public health promotion. And one more thing with that, also from a park setting, is cultural competence. And I see Dr. Rosenaka on here, and if we are not approaching people with them, but we're approaching them at them, we're not going to get very far. Right. And so knowing our cultural humility and cultural competence is so crucial right now, especially when not only youth, but even as adults, we are not back to know how to even work with each other and communicate with each other.
Right. And to piggyback on cultural competence aspect, we have to tailor our services to the needs of the mothers, the actual need of the mothers in our community. So if we are saying the mothers have to exclusively breastfeed, and if that's what they need to do, then we have to tailor those needs to meet what the mothers are echoing, are their sentiments in in the communities. And you touched on something, you touched on health promotion. We have to create this awareness about what is needed in the community. And it starts with needs assessment. What are the needs in our communities? What are the needs for the mothers? Even though we have, we can say, okay, we're addressing minority communities, some minority communities differ in needs. So that's actually something we have to take on, like, okay, so what is the need of this population as against this particular population, even though they are all minority populations? What are the needs of African Americans as against the needs of immigrant populations? They are all in that category of minority population. Anyone want to?
I'd like to, because I want to push back a little bit on that. Going into community, like prior to this, being in academia, I was into like activism a bit more. And so it was really oriented around community. But I don't tell people what they should do. What part of starting with education, what are you doing and how can I help? And it's like, then from there, we can kind of leverage the resource and find out what's missing, which is part of our needs assessment, to identify how to move the needle for that family, that person, because there's a lot of things that are happening that make walking outside difficult. One thing I even wrote a paper about was around food apartheid. It was one of the things that came out from my research was food access and how different it looks, especially in segregated cities like Chicago, where you have 80% of Black folks living in like 27 of the 77 communities. And so when you have that high level of segregation, where you're talking about over 90, 95% some communities, and there's absolutely no access to food because it's on the outskirts of that actual community. There's no access to a grocery store. There's no access to a convenience store hardly. There's no access to small stores like even like Aldi's, which is, I kind of consider like a small grocer of it, but it has enough, right? There are communities that just don't have that. And then we talk about the environmental justice. So that's where I kind of think of the community activism part that comes in, but it informs us. So when we have these dialogues and we're just having conversation with people and we're saying, tell me about, how is it to walk? How is it to get exercise? Eating, like what is available? And then that is what informs how we, in our position, can inform policy that can improve place to make it accessible for people who live there.
That's an excellent point. That is an excellent point. Heidi, you want to say something?
Yeah, so definitely to piggyback off kind of what everyone's been discussing, I think, academics and professional experience can, really help shape a career over time. But it's almost kind of, you learn the technical skills you need to do your job, you go to school and get kind of the classwork behind you. But I think, what really helped shape my career was more of the soft skills that you learn along the way. Like Dr. Lofton was saying, like collaboration with the key stakeholders in an issue. So I was lucky enough for my first job right out of school, I worked with biostatisticians, I worked with other toxicologists, I worked with epidemiologists, and knowing that you're not on an island and learning to collaborate with other groups is really so important to I think career development, because there's only so much you can do with your own skills, and bringing in the right partners is so important to getting that information so that you can actually make a difference in the work that you're doing. So that's definitely one of the main things I learned at my first job right out of school is, get help, talk to who you need to talk to, see what else is going on, and get different perspectives from all of the stakeholders, because it does make a difference. So that's really all I had to add. Great answers from everyone.
Thank you, Heidi. Thank you, Heidi, for bringing that concept of stakeholders. As we go into the next question about mentors, did you have any mentor that influenced your career path? Was there someone or some people that actually molded even though you have this idea, you're going to go through this. You're going to become a toxicologist, or you're going to become a nurse, or you're going to become a health educator, or there's someone that actually said, yes, this is what I see you doing, or people that actually encouraged you along the way. So anyone, if there wasn't, you can say there wasn't. It was all you.
I can start since I'm already unmuted. I was so lucky in my undergrad. I had a wonderful advisor, and I know you were kind of mentioning someone who says, like, yeah, this is it, like, go for it. He actually helped me decide what I didn't want to do, which ended up being so important too. He, with his connections, he was able to say, all right, if you want to be a pharmacist, great. Why don't you shadow a pharmacist? See what a day in the life really would look like. So that actually was so helpful for me, because he connected me with other professionals that I was interested in kind of what they were doing. And he kind of supported me in making that decision. I thought, I'm going to be a pharmacist. This is going to be what I do. And, it really helped to hear someone say, you don't have to do it if you didn't like it. It's okay. There's other things out there. You can always change paths. You can always go back to school. It's okay to take your time and to make moves. So I think that was so important for me. And, it took me 10 years to go back for my master's, and I'm glad I took that time to get the professional experience first. So I think that would be the best advice. You don't have to follow a specific plan. It's okay if there's a fork in the plan. It doesn't have to be a to B kind of thing. So I think that was one of the best advice and support I got.
Yes. And weigh your options. Yeah. Weigh your options. Mm-hmm.
I can say, I always say my group of mentors was Chicago Public Schools collectively. I was there for a long time. Is where I decided to go back for my PhD for a lot of reasons. But part of it was that there was a need for a reflection in the community of something different in some spaces, especially where I was a school nurse at. And I think that being able to go back to the same communities in which I was a school nurse at, and even opportunity to interact with the nurses that really were mentors for me. And so that being a part of that system, it actually has been one of the main reasons I'm able to navigate academia now.
Wow, that's good. That's really good. Colin.
Same like undergraduate. I think that was something that I was Dr. Sandra King, who was definitely about food equity, and this is 25 years ago. And she always did the farm walk, and she really was someone who you need to roll up your sleeves. You can learn, but you need to apply, and you need to learn to implement, and you're going to stumble and you're going to make mistakes. So similar to Heidi, it was 25 years since I went back and got my master's. Working at WIC, I had a director that had an MPH, and I didn't know back then. Like MPH, it was obviously so important, but I was like, what is an MPH? What does that entail? So as a dietitian, I always saw the connection. But really, Dr. Woznicka, when I had her interns, she is one of really another one that was, I didn't even know about Northeastern's program. They were developing it. So I would say like undergraduate, and then kind of always thinking about MPH and working. I worked at Ingalls Memorial Hospital in Harvey, and that really resembled a lot of the neighborhoods, the 77 of communities of Chicago, by no means equal racially, from a health equity standpoint, from a food access standpoint. Being able to take an intern and explain what I did made me realize that I needed to up my education. And Dr. Loughlin, just having a PhD and MPH, I'm always like, I'm never going back, but you give me such inspiration right now to go to that next level.
Wow. The best advice I received was from Ruth Lubick, who is a well-known nurse and midwife. And her words are, the people you serve are your strength. Listen to them and you will be rewarded. And that has just helped me so much. I ran a birth center for 10 years in Beverly, Massachusetts. And it was a hospital-owned birth center, even though it was a freestanding building, et cetera. But I had to deal with constant administration saying, we're going to close the birth center, it's too expensive. Then you'd have to look at the rules and regs, and the Department of Health is saying something. So all that public health policy and advocating for the women and the families in that birth center was on my shoulders. I just felt like it was my burden. And Ruth tells you this, and all of a sudden, when you turn to the families and share the burden, they have the ideas of how to fix it and how to make sure that the hospital isn't going to close you and that you're going to expand and add on to the building and do those kind of things. So that idea of the people you serve are your strength and you're not holding this all yourself. And I think sometimes we really forget to respect how resourceful and resilient people are and look at their strengths and not just the things that we think, oh, so sorry for them for. I mean, it's really, we need to look at how resilient people are, listen to what they need, listen to their ideas of how to fix the problem.
Right, right. It's so true. It's so true. The people that we serve should be the people we should actually listen to because they actually hold the ace. They're the ones that hold the card, the ace to whatever solution we seek to bring to that community. That's excellent. Okay, so now we've talked about the good part. What were some what were some challenges? This is life. We're in life. Even though there is the positive side, there's always the negative side to life. So what were some challenges we experienced in our career and how then did we overcome them? So what were some challenges or bumps in the road that we experienced? And how did you overcome it? Okay, nobody had any challenge?
I had a lot, but I'll name one. Well, I wasn't a challenge actually. It was just something I had to work around, work through.
Yeah.
So in my first semester of my PhD program, I gave birth. And so that was, kind of hard. It was a newer PhD program because I attended Rush. And I was like, oh my gosh, how am I going to do this? I got 2 kids under 2, and I was still working full time.
Wow.
And I think I still was working at extra nursing job. Nurses like to work a lot of jobs. And so I was, trying to figure out, and, it took a while, some people finish, the PhD program in like 3 years. I was twice that, but I finished. So it was just a matter of like how to schedule to still be a mother and, do all the fun things with the kids while still getting, working on dissertation. And it wasn't easy. And there were still even, challenges afterwards because you want to have that balance. But, it's one day at a time. And that it's going to be some days where it's not going to be all that great, but you keep pushing forward anyway. So.
Right. To piggyback on that, we just celebrated the International Women's Day early this month. And I just want to celebrate all the women, because of what Dr. Lofton has said. We do a lot of multitasking that I don't think men will ever understand. Like we birth babies, we care for these babies, we work full time, we work part time, we put food on the table, name it. So I just want to use this opportunity to congratulate all the women for their hard work and for their input to nation's development. Congratulations, congratulations. Okay, so who wants to go at it?
I'm happy to go. And I agree, just keeping on the motherhood. We womanize ourselves. We feel bad taking off a day if our children are sick, but why is it always, our job? I had another inspirational woman say to me, not to be anti-male, but they, like if a man has to take off for work, you take off for work. But why do we feel that we always have to be there? We can't miss. We need to go back, like you said, Susan, is rely on other people and know that people have our back. But also just from a systems change point, I know in a university, hospital setting, and any government setting is systems change is one of the hardest things I've had to work with, because it's definitely not done. And again, knowing that when there's a program developed from a public health standpoint, is how are we sure it's being done with the efficacy it needs to be done? And so in public schools, we see this all the time. That this great and huge NIH grant, National Institute of Health grant, it gets done, we do it, we pilot it, but then how does a message make sure we're getting it through clearly and understood? So I think a challenge that we still have to work on is how do we take research and data and bring it to the public consumer level?
Yes, that's a good point. That's a good point. All the research and data out there, how then do we morph that into addressing the need on ground? How do we morph that into addressing the needs on ground? Okay, so
I want to piggyback on that because I was thinking about challenges, and one of the biggest challenges for midwives is nobody knows who we are and what we do and what good we can do. If you look at the rest of the world, everybody knows what midwives are. You walk down the street, ACNM has a little video where they ask people, what's a midwife? And the answers are hysterical because people don't know. And, you know, talk about a challenge. It is getting rid of the misconceptions, getting it out there so people understand, and showing that maybe something that isn't the typical establishment actually works. And that is just constant. It's you're always given the elevator speech. You're always talking about it, as I'm doing today, because it matters and we need to make a change. And the World Health Organization talks about how many women in the world we could save if we had more midwives. And so I think that challenge of learning, and then somebody talked about interdisciplinary, how we all need to work together because none of us do it alone. But to be an unknown profession and a very small profession is a constant challenge.
wow. So we need to create more awareness. We need to create more awareness in this area, and it's needed. It's really cogent and it's needed. Okay, Heidi, do you want to say something?
Yeah, I had in my mind planned on talking about burnout and time management, but after Colleen and Dr. Lofton, I don't know how much I can compete with that, but you know, that was definitely something I faced going back to school part-time while working full-time. I was definitely facing burnout and having trouble prioritizing my time, and you know, like Colleen was saying, feeling like you have to do it all as a woman. You know, I have to excel at school, I have to excel at work, I want to do well in my personal life. So I definitely was approaching burnout. And I think what I really learned was reaching out for help, whether it be family or, you know, leaning very heavily on Colleen and other classmates during school, you know, again, with the collaboration, it's okay to ask for help, and it's okay to, you know, bring other people in, and, you know, was able to study with others, which, you know, really helped me on the school side of things. And then I ended up actually talking to my manager at the time, just saying, you know, I really had to put up some boundaries. I can't work, you know, in the evenings, that's time for school, and just kind of really learning to be an advocate for myself. So learning to speak out for myself, learning to, request accommodations if I need them. So I think that was a hard thing for me because I always want to please everyone and do well and do it all. But I think, you know, balancing that side of things with also taking care of myself, I definitely ran into that in the past. And another thing I was going to mention is I had felt before my master's, I was approaching a ceiling. I could only kind of grow so far in my career. And that was one of the reasons I went back for my MPH, was to really empower myself to open those doors and feel like I could, you know, continue to grow in my career. So I think those are two things that I kind of experienced. But yeah, can't relate with the motherhood. I can't even imagine how stressful that is to juggle school and motherhood. That is so much. And society puts so much pressure on us women to do it all. So, really asking for help and setting some boundaries, I think, is one way to combat that.
If I can say real quick, Heidi, I think you said it all. It's the undertone of even talking is still time management, is reaching out for help. So I don't want you to feel like that was a very valuable contribution, because it actually gets to the foundation of what we're talking about in terms of addressing challenges. I just want to say that.
And as you said, Heidi, you mustn't please everyone. Pleasing everyone can lead to easy burnout. That's the fastest way to to becoming overwhelmed and then to burnout. So that's good. That's good. So let's think about, okay, this role. We are now in our career paths, our cherished career paths right now, and thinking back on it, what skill or skill set did you feel was important to develop this, successful career path you're in right now? Maybe a skill set you developed in undergrad or outside or post-undergrad. Like, was there a skill or a skill set that you had to develop?
I could talk about this one. There's definitely specific skills in my career that were important. You need the technical skills, but outside of that, there's so much more that can help a career. And I think one of the biggest things that really helped me along the way is networking, opening your scope to all sorts of different activities, just like this panel. Making connections with other people. Talking to other people, hearing what they're doing. So for example, Colleen here on the panel actually helped me get my internship for my Master in Public Health. She made that important connection for me with my advisor for the internship panel. So you never know, who you'll meet and what you can share with them. So I would say networking has been really big, and it's fun. You can meet a lot of fun, wonderful people and learn about what they do. So I would say that has been probably my favorite skill that's helped me.
Heidi, that's an excellent point. That is an excellent point. Colleen, since you mentioned your name.
Popcorn, as we all say now, popcorn it over. Yeah, I think pretending like you don't know it all, listening is a huge skill. It's just if we don't listen, we don't learn, right? And so we always there's always more to learn. But also I think it's really important to just understand where everyone's coming from, right? Like I was in a session yesterday, not for this, but we were doing a post-traumatic stress yoga training for our staff at the Park District, and trauma to one person may be a completely different trauma to someone else. And so understanding that there is such differences in where we come from. And another one I think is understanding true implicit bias. It really, we don't learn unless we make mistakes in what we do and what we say. And I take that implicit bias training all the time, because we can't forget the way we see the world and the way that people see us. We have to keep our eyes open. And some, there was actually National Recreation and Parks Association, the director of Diversity, Equity, Inclusion said, every day I go to work, I have to say to my team, do we come ready for the day to prevent or to promote health? Every single day checking in with ourselves before we check in with anyone else.
Right. Colleen, you just took the words out of my mouth when you said listening, because it has been burning in my mind. And you do a lot of learning. We do a lot of learning by just listening. Sometimes if we just could listen instead of talking, we would learn a lot. And as you said, implicit bias, sometimes we are unconscious of that. And I teach a class in healthcare administration, and the leadership aspect of that class, I asked my students to take this implicit bias test. There's a test out there, and actually opens you up to what you feel might not be biases that you hold, and we actually need to be conscious of that, even as we, as Heidi said, actually network or communicate or try to collaborate with one another so that we can actually appreciate people and their differences and what they bring to the table. Dr. Lofton, you want to say something?
I would say the networking, I think Heidi did it, with networking, soft skills. I would say like it's a really important thing for people who are definitely a little bit more introverted, because it's hard to network, unless you're coming to spaces like this and, just introducing yourself to people, but finding ways. I found this, if you can, the skill of gratitude, and I'm going to have to, because it sounds like, oh, that's just, something you do, but how do we in action, gratitude in action? And Heidi talked about it. It's like, okay, with the internship and how Colleen helped her with that, and how we can constantly continue to build community and networking through ways, whatever, that we have, that we can help others and continue to build our networks in that way, and how that could feed into something really positive and big, a spin off of a project or whatever. So I would say that just to add on to that, because I think that was really key.
Okay. Finally, Susan.
I'm going to talk a little bit about actual research in terms of learning a lot of from my mentor, Dr. Ritchie, when I was working on my dissertation, and the beauty of mixed methods research. We all love the numbers, and that's really great. And they tell us a certain amount. But we were looking at the caring program for children, and if we gave families these caring cards, like so they could get immunizations and ER visits and things other than hospitalization to the steel workers in Pittsburgh who no longer had good jobs and good insurance, what was going to happen? Well, fairly obvious that they're going to get their immunizations, and they're going to, that stuff is going to go up. They're going to be more up to date, et cetera. But then when you ask the families the questions about what has this meant to your family, and the mothers say things like, well, I can now let my son play sports because I know that if he goes to the emergency room, we won't lose our house. This idea that the numbers say one thing, but the richness of the experience comes with the qualitative part of things. And that's the part I kind of like best. So I have to force myself to do the number part too. But I think that, again, it comes down to a number of things that people have said, the listening. It also comes down to the networking by having, the project I did for my dissertation was huge, and there were so many people involved. There were biostatisticians, there were nurse practitioners who went out to the home to do the interviews. Again, we can't do this by ourselves. And so just that idea of combining the soft skills, like Heidi talks about them, but the feelings and thoughts and qualitative piece of research with the numbers and stuff.
Right. So as we actually wind down, I think we're good on time. Still, I've been monitoring it. Let's offer advice to those that are on right now, students that are on, or colleagues that are on this, not on this particular program, this section of the program. So what advice do you have for students? The same way we were all students and we were receptive of advice from, our professors, teachers, and all that professionals out there. So now you're in that position. What advice would you give to students, maybe in the public health program or in the Bachelor's of Community Health program, or other students that are actually logged in listening? about picking, a career path or picking a major?
I would say travel abroad would be the one piece of
That's a
advice.
That's a good
Yeah, I think it shapes some things and it shatters some ideologies that you may have. It makes, because I know that I would go back and forth to Malawi for 3 years, and it changed my whole worldview in many ways, and it helped with my research. So it helps kind of guide whatever career path you look at, having those experiences outside of the US, outside of the West, actually, I think is very valuable.
That is an exceptional point. Exceptional, because I don't know whether it's because I'm biased about the point or because I'm actually from that continent, but it's good for people to have an experienced worldview, not just a worldview that you have in your living room, but an experienced worldview. As Dr. Lofton has said, travel out. Don't just take what you see on TV, hook, line, and sinker about countries or about what's going on healthcare-wise in other countries. It's good to be on the ground if you can travel out, kind of have your own first-hand experience of what's happening in continents in Southeast Asia or in Africa or in Australia. Travel out. It would really reorient you as an individual. That's an exceptional point. Yes.
I can go next. That was a great point. Kind of along the similar lines would be to get that real world experience. If your program has an option for this, or if it's something you can do on top of your current class load, I would highly recommend an internship. So my most recent internship was during the MPH program. I worked with the opioid epidemic, and as a toxicologist, I understood how it worked, why it was an issue, kind of the history of opioids as a medication, but not until I was really involved. I was with the Chicago Recovering Communities Coalition. They were working with the public, providing Narcan, training, providing services. So until I was, talking with the community and working with these community leaders, I didn't get that full depth of the issue. So, your academic training might, give you the basics, but getting out there in the real world and getting that experience to talk to people whose everyday life is affected by what you're working on, I think was so eye-opening for me and really valuable experience. I would say if I had another takeaway or piece of advice, it would be take your time to, make your path. Like I was saying before, I kind of wobbled back and forth, was originally a music major. So obviously went very off that path, had thought about pharmacists and ended up here. So take your time. It's okay to change your path every now and again. And don't be afraid to explore things that you're interested in. And talk to professionals in those areas. So yeah, I would say real world experience, get that internship, it's awesome. And, take your time and explore.
Take your time and get the required advice, buttress that with some advice from those that have actually gone that part, like Heidi, right? So take your time.
I'm going to bounce off Heidi because I agree. It's don't take the easy route. Sometimes you're like, oh, I just got to get through this because I took going slow, firmly agree with, because it's not a race. You're not in a competition with anyone else, although it does seem like you are, right? I mean, the competition is rough, but you find your people through your classes, but also try something you don't think you're interested in. Because one of my jobs earlier was as a renal dietitian, and I hated renal in undergrad. It was so the angiotensin, and I loved that job so much because the impact was so impactful. So, think out of the box. Don't be set in your plan because there's always going to be a bump that knocks you off, and you got to be ready for that bump. And sometimes that road you didn't know you were taking is your best route you can take. So sometimes take the hard way, read the books, do the reading. Heidi taught me that. It's you've got to understand it to be able to apply it. So, and time manage. I mean, we've talked so much on this on time management, and sometimes the busiest times of your life is when you learn your best time management and you get the most success, because the downtime doesn't always give you efficient time. So.
Right. Time management, because time waits for no one. Yeah. Susan?
I'd just like to say, follow your passion, what you're passionate about. It's important to put your energy where it is good for you and good for people around you, and that you really want to make a difference. It's hard to get excited about things that don't seem so important. And I do understand that we should look beyond what we are actually doing. And so in a way, I'm contradicting myself, because, if you love being with women, having babies, that's great, but you need to look at the whole system and how we're failing the whole system. So I encourage anyone in healthcare to, as we were saying before, combine the individual with the public health, because that's the only way we're gonna really make the difference. And I think that we are doing that more in nursing now. We are looking at population health, et cetera. And a lot of people don't like it, and they find it complicated, epidemiology and the statistics. And, I used to teach students about community assessment, and it was hard for them to understand, but it's critical that we understand that, because that's going to make it better for everybody. So follow your passion and put the energy into making a difference.
Yes, that's true. Following one's passion, because sometimes students actually, maybe go into nursing or medicine, and they're like, oh, I just want to do it because my friends are doing it, or because they make money there, and they get into the actual clinicals, and then they see blood for the first time, and they're passing out, and they're like, no, I'm not going to do this anymore, and they drop out. So follow your passion, because your passion will get you through when the going is tough. So yes, follow your passion. Alicia, I think we've come to the end. I'm looking at the chat right now to see whether anyone has questions.
We had some great comments in the chat. I didn't see any questions come in as of right now. And I just wanted to take a moment and thank all of you guys for sharing all of this wonderful information, advice. I mean, I was sitting there and I was like, wow, this totally resonated with me, and this, I just wanted to touch on a few things that really I felt like were great points. And, Heidi, you were talking a little bit about the poor experiences, or the things that you like, having those experiences that you didn't like. And in this, like I had that multiple times where I felt like all the way up to the job I was in now, I was doing things I didn't want to do, but it was so helpful to know when I finally did do something that I wanted to do. So then I got to a point where I was like, oh my God, yeah, I totally want to be doing everything that I'm doing now, because I felt like I'd been doing things that I didn't want to do for so many years. And then that whole linear process of your career path, it doesn't have to be straight. It can be up, down, zigzag, and there is no right way to do that. I took 5 years to get my undergrad, and then it took me 5 years to go back to go to school. And that's still a normal way of looking at careers. For me, that was something that always felt pressure about. Like, I had to do it in the 4 years, and then right after that, I had to go to get my master's. And if I didn't do that way, it felt like, oh, I was failing at what I was supposed to do. But then I had to shift my perspective to be like, no, it doesn't have to be that way. But anyway, and then also when we were talking about the invisible work that women do, I think that's so crucial. There's so many things that we do without talking about it, or that people see, like we're keeping our households together. We're making sure our families are on their schedules on time. And then we're also working full time, maybe going to school, maybe also trying to plan other big events in our lives. So it's so important. Anyway, I won't ramble too much. I was just very excited about it.
Yeah, I think we have a question from Susan Oladipo. I think Susan would answer the question, because it's about doulas in our communities. how are doulas role integrated in community public health? So we have that question from Susan Oladibor, and I think Susan would be best fit to answer the question. So how are doulas' role integrated in community public health?
Yeah, doulas play an incredible role. Doulas are not medical professionals. They are support people, people that keep the space safe around the families. And they are being used more and more often, especially throughout the maternity cycle. When I was talking about these community birth centers, many of them have doulas. Many programs have doulas for hospital birth, et cetera. The exciting part also about doulas is that there's the need for them in the postpartum period, because that is a neglected period and a period where a lot of maternal mortality actually happens. And so the idea of supporting a family as they integrate this baby over 6 months to a year after the baby's born is amazing. I had my very own doula when I had my daughter, which was my mother. She stayed with me 6 months after the baby was born. And it was so amazing because the first 3 months I didn't work. I just focused on the baby. Second 3 months, the next 3, I was back at work, but she brought the baby to work and watched the baby so I could nurse my daughter because she wouldn't take a bottle. So it was like crazy. But having the support and someone to talk to and do that, there are so many programs, and I think we're doing more of them in communities because people want to be involved. They want to support mothers, but again, how do they do that? So that they would do a doula training program and then they can become involved with the family. So absolutely majorly important doulas.
Yeah, and that's really interesting. And to continue a little on that part, with regards to postpartum care and maternity leave, we're talking about the United States, even though it's a developed country, we still struggle with maternal care. And when you talk about maternity leave as compared to other developed countries, other Western countries, like maternity leave in the UK is like you get at least 6 months off or 3 months paid, and then the next 3 months you get half a pay. So you can take off 6 months, and that's what we're still struggling with, that maternal assistant. The mother needs, time off after delivering that baby, after pushing out that baby, so like how exactly are we addressing that concern, even if it means policy-wise?
We need policy-wide change. The interesting thing is that our country believes in individuality and doing everything on your own, and we don't need to help people. I was in Norway, and both parents can take a year off when a baby comes. But we expect a woman who's had a cesarean section to go back to work in 6 weeks sometimes because they don't have decent maternity leave. And this is like major surgery, and they have to work and still juggle a baby and figure out, and breastfeeding is important, but how can you pump when you're at work? And not having the society care enough about its mothers and babies to say that businesses should supply people with maternity leave is criminal. And that's why we have the problems we have in this country compared to other countries. Even some of the problems that develop later, which is, that time period of bonding and developing family strengthens people and helps them grow to be good social people that can get along with people rather than being, what do I want to say? Being so caught up in other things that are important, like, we have to get a new car and we have to do this and we have to do that, rather than focusing on how do we grow this child in this family to feel loved so they go out and feel love for other people. And so we look at the mental health crises we have. You can take that back to, do we nurture our babies after they're born? We put a lot of time into prenatal care, but do we nurture the family after the baby's born? So yes, it is just crucial, and we should be doing what other countries do.
Right. We should. Alicia, any question in the chat? I see a question
from Laura. Laura, I didn't know if you wanted to maybe, yeah, if you wanted to ask your question to the panel, or we can ask for you. So,
sure. Yeah, I'd be happy to ask the question. I heard earlier some of the panelists talking about, the importance of listening to the people they serve and the communities. And so I was wondering, a little more detail about maybe an improvement you've made by partnering with or listening to the suggestions of the people in the community that you serve.
Well, I think it's an ongoing thing, but with one of the programs, we were looking at food access in Garfield Park and in Inglewood. So we partnered with a bunch of other stakeholders around food access programs. And as a result of, and in partnership with that, also created like a community advisory board and worked with one organization, Chicago's Food, which is a coalition of like food-based garden, urban ag organizations. So with our partnership with them, we were able to create a community advisory board to help direct our research and what they feel is needed for them to improve their programming and what they want to do in the community. But also with Chicago's Food, we were able to, they wanted to evaluate their program because they had, during the pandemic, they provided grow kits across the city. It was like about 3,000 or so grow kits, and it still goes on, but they provide the grow kits to Chicago Public Schools and other organizations. And so we were able to give funding to evaluate the program. And then as a result of evaluating the program, the grad student that works with me was able to publish a paper that was co-authored by folks from the coalition and that wanted to be included in the paper. And then we were able to utilize that data to support additional funding that would be solicited or, if they reached out about that, because we were able to get that from internal funding. And then also some of the ideas that came out of the community advisory board in regards to like how to cultivate or archive some of the things that have been done in the community. Because often when you talk about Garfield Park or Inglewood, all you hear is violence and shootings, but there's a lot of great people and great resources and great assets and great work that happens there. So we started working with another organization about how youth can actually develop like a social marketing campaign around food access. That's not what I wanted initially, but they said that they wanted on anti-littering. So I said, you know what? It's yours. We're gonna do it and promote it. And that's what we're in the process of doing now. So it's a slow process sort of, but it's like, as long as it's being directed by the community and how they want this to go, I say, look, if I have the resources and tools to help facilitate that, that's what I do. And then it grows on its own, it's organic.
Okay, Laura, does this answer your question?
Yes, it does. Thank you.
Okay. Alicia, back to you.
Awesome. Thank you. I see, Emma, you put in a great point too in the chat as well about learning technology before starting school programs and things of that nature. So it's really important with like management later on in school programs, as you were mentioning. But yeah, so does anyone else in our audience have any questions or comments they'd like to make to any of our wonderful folks on the call here today?
Dr. Ulrich, I have a question for you. I would love to find out more about this program with midwives, because it's such an the awareness needs to be so much stronger. And we can touch offline, but how would you go about in a master of the public health per se, before you get to the PhD, obviously, how would you find out about which road to take to enter the level you're in of a midwife and nurse. You have to have the nursing background, or do you like? Is there other roads you can take, whether it's nurse practitioner or all?
Yeah, thank you for the opportunity to talk about it. In the United States, there is a little confusion about midwifery to begin with, and that's partially because nursing itself has a little bit of confusion. What's an RN, what's an advanced practice, what's an associate degree, what's a bachelor's degree, et cetera. But to become a midwife, there are certified nurse midwives and certified midwives. So one is a nurse and one is not a nurse, but they attend educational programs that are accredited by the Accreditation Commission for Midwifery Education, and they take a national certification exam given by AMCB. And then they are certified as a certified nurse midwife or certified midwife. The American College of Nurse Midwives added the certified midwife option because we knew that some people only became nurses to become midwives, and so that was a barrier. And so we've developed education programs that give them some of the nursing skills that we need to be midwives. So you can be a certified nurse midwife or a certified midwife and take the same boards. The practice is in all 50 states, certified nurse midwives can practice. In many or most, we practice independently. And in many, we are practicing as advanced practice nurses. So that's a little bit of a problem for certified midwives since they're not nurses. So we are trying to get them licensed in more states. Right now, they're licensed in 5 states. The other group of midwives are certified professional midwives, and they have certain education programs that they have to go to, and they take a national certification exam, and they are licensed in a lot of states. They do a lot of community birth, home birth, birth center birth. Whereas certified nurse midwives do a lot of hospital births, and so do certified midwives, although we also do birth center and home births. And then there's this category of people call them lay midwives or direct entry midwives, who do have a certain amount of education, usually apprenticeship, and then they learn it from another midwife and then become a midwife. They don't meet the International Confederation of Midwives definition of midwifery, because midwifery, they say you need education and licensure and an exam. But we also want to honor some of their knowledge because they do bring a level of knowledge that is really important. So it is kind of a ballpark figure. But the Centers for Medicare and Medicaid acknowledge certified nurse midwives and certified midwives. We're trying to get them to pay for more out-of-hospital births, and that would include the CPMs. So some of that stuff is in the works, but the whole health policy around this is not easy, because in some states you have to have a physician to say that you can work as a midwife. And so getting independent practice and things like that are important policy issues. The new legislation, the Moms Act and things like that in Congress are trying to strengthen midwifery. They're trying to increase funding for education of midwives and more education programs, et cetera. So there is a push, because we have found that midwives do make a difference. And so America is behind 8 ball because we have so few midwives practicing, even though we have all these different kinds. So there are some things that we really need to do in the policy arena.
Thank you. Thank you so much, Dr. Albert, because I also, and just because we're at this Women in Science and it is Women's Month, is as a dietitian, it was a very female-led profession, and the salaries followed a very female-led profession. And so I acknowledge the science and the training behind your profession. And I just think we have to continue to fight for equal pay and equal attention, because that's a whole other conference. But thank you, because I've never been walked down those steps. And I think it's really important that we all hear that.
Thank you.
Yeah, thank you. Dr. Zach, I saw you had your hand raised a little earlier. I didn't know if you wanted to unmute and ask a question or add to what was said. Okay, maybe she stepped away. I just wanted to tag her in if she wanted to make a comment. Any other questions or comments from our audience? Okay.
That's a good one.
So I'm not seeing any additional questions coming in. So I did want to thank all of you wonderful speakers and panelists and facilitators for your time today and sharing all this wonderful information. I think there were so many valid points that were brought up. I got a little excited right at the end there. I had to share a few of my comments too, but you know, it's so empowering to hear all of the different stories and experiences you guys have had in your career paths. And I hope folks in our audience were able to take away and, you know, maybe help that you guys through your journey as well. I know we are wrapping up a little bit early, but again, thank you to our wonderful panelists and facilitators today. We really appreciate your time. And at this time in our agenda, we are having a little bit of time to give everybody a lunch break. So we'll start that a little bit early. I would encourage everyone to come back at 1 o'clock. We've got a great activity surrounding climate change and solutions. So I encourage everyone to come on back, but of course, take your lunch break, make sure you get some good food. And I will see you guys back around 1 o'clock. Thank you again, everyone. We'll see you soon.
Thank you, Alicia.
Thank you. Thank you, everyone. Thank you.
Thank you.
Bye. Alicia.
Yeah.
Oh, can you see?
I got you. Yeah, you were spotlighted still.
Okay, this is not a one-on-one. Okay, so maybe I would have I guess I see. Let me see. Okay, so the next is at 12:01.
It's at 1 o'clock, our
Okay.
next session.
Okay, yes. Okay, I see that now. All right. Okay, enjoy your lunch break. And I gave you extra 13 minutes to the lunch break. So, right. Keep up the good work, okay? See you soon. Bye.
sugar.
How you doing, Bozina? Can you hear
Who's
me?
this?
This is Andy. Can you hear me okay?
I'm sorry, Andy who?
This is Andy Pinelli.
Okay, so I'm Zoom. This is the
For Women in Science, yes.
yes,
So Andy's our next speaker, and he is just saying hello to everybody.
Oh, okay. So my name is pronounced Bojana.
Bojena, okay.
Bojana.
Bojena, very good.
I cannot see you. Can you see me?
I can,
Can you can, right?
yes.
Yeah, your camera's on.
Okay, good. I'm having a little difficulty. It says Zoom login or something.
Is it just like another icon off to the side? Because
No, it's a whole screen.
is it after you had logged on to the Zoom line and it's in your browser?
Well, when I logged in, all it gave me was just some kind of like shots of something. I couldn't hear anything. So when you said, when you said something, it really was it's good that I heard something.
Are you seeing the shared screen on like the slide on the screen? Okay.
No, I'm only seeing Northwestern Zoom web conferencing tips for securing your meetings.
That screen came up when I was there too, but that can be, what you need to do is click on your Zoom icon down below, and then that will disappear and you will be in the Zoom call.
Maybe I can just join. Let me try joining. Connecting to a meeting in progress.
You're already joined. You don't need to join.
I'm already joined. Okay.
You just need to look for your little Zoom icon at the bottom.
Well, let's see.
Make that bigger.
I don't have it. Let's see. Okay, let's see. Okay, no, this is not. Let's see, I'm not sure where I am.
Let's see. Stop share here.
Solutions for climate. Let's see. Now, maybe I'll just start all over again, signing on. Jeez, I wish I had that. Let's see.
How do I stop share?
I can maybe stop sharing for you.
Yeah, I think you've got that multiple share button on, and I'm not seeing how to stop share on there.
Oh, wait a minute. I think you came into view. Okay.
Is that better?
Yeah, okay. Yeah. Yeah, so I may need you to stop share for me.
Okay.
Alicia, and that'll happen a few times during the presentation.
Okay.
Because normally I have control to stop share, and I'm not seeing a stop button after I share.
Right.
Okay.
So Andy, when you were sharing screen, you know how sometimes at the top of the, like when you hover over it, did it give you the stop share icon?
No,
Oh, okay.
it enabled me to share, but then when I looked for the stop share icon, I wasn't seeing it.
Okay.
But it seems like you have that control.
Yeah, I can like start share, like overshare, like oversight sharing on you, and then it lets me like stop sharing my thing. That's very strange that it's doing that. Hello, everybody on the call. We're just waiting a few more minutes to let folks trickle on in. I know we just had a nice little lunch break. So I'm sure folks are just taking some time to get back on the line.
Oh, there it is. Yeah. Now I have a stop share icon.
Okay, good.
And let me make that a little bit bigger. Alicia, has there been a lot of subject matter related to public health on the agenda so far?
Yeah, so we've had a lot of interesting different topics. Yesterday's sessions, we had various of them. Oh goodness, losing my marbles a little bit. We had one person that actually talked a little bit about the intersection between art and science, and she addressed some of like environmental impacts and how art was being used to kind of bring awareness to it. We had another speaker talk about community engagement from a research institutional perspective, and then also from like a community perspective. So it was very interesting. We had some folks from Gift of Hope talk about organ donation and transplant in the public health eye. We had a couple keynote speaker, two folks for our keynote speaker from the Chicago Department of Public Health, and they talked a little bit about the Healthy Chicago initiative and kind of what was going on there. I know I'm missing a few folks too, and earlier today we had a career panel, and so it's been pretty packed couple days, and I feel like this is a nice activity. Oh, we also had an activity yesterday on the determinants of health, so this is our second activity that I'm really excited about.
Beautiful.
And with that, I'll go ahead and welcome everybody back. I know we've got a good crowd accumulating on the Zoom line. Thank you, everyone. I hope you had a nice little break with everything. Again, this is day 2 for Women in Science. And this session is the public health implications of climate change and solutions. We have our speaker, Andy Pinelli, who is a citizens climate education and citizens climate lobbyist through Chicago chapter leader with the En-ROADS Climate Ambassador. So he'll kind of walk us through some great information and an activity. I know he's joined by one of his colleagues as well, Al Wagner. Welcome, both of you guys. We're so happy to have you. And with that, I'll go ahead and pass the floor on. Oh, excuse me. Before that, just a little reminder for Zoom etiquette. Please remember to stay muted during the discussion pieces of things. There will be an interactive part towards the end of the set, or middle to end part of the session, and we'll kind of guide you guys when it's time to unmute and things like that. Everyone is welcome to share their video if they'd like. Just be mindful of, the background that your video might be capturing. So without that further ado, I'll go ahead and pass the floor to you, Andy.
Thank you, Alicia, and welcome everybody. It's a pleasure to be here with the Women in Science Conference. Just for background, Citizens Climate Lobby and Citizens Climate Education are nonprofit, nonpartisan advocacy organizations, grassroots, all volunteer driven. And these are organizations that try to educate people on climate issues and also advocate for smart climate legislation, preferably bipartisan. Today, we're going to talk about climate change and kind of the public health implications of it. Also, we'll talk a little bit about the root causes of climate change, and we'll also brainstorm together some solutions to climate change. Just after the first part of the presentation, this will become very interactive, and we're looking for some of your ideas of what should be done about climate change, or what some of the solutions might be. And feel free as we go along with this presentation, as ideas come up to you, stick them in the chat, stick your first name in there and maybe what your solution is that you want to see modeled. And then we'll talk a little bit about what we can do as individuals. But I will be introducing to you today the En-ROADS Climate Simulator from MIT Sloan. This is a powerful new climate simulator that's been 7 years in the making. And we will make this simulator available to you at the end of the discussion so that you can play with it. But this is a tool that is going to help us gain new insights on the climate issue and how to solve the problem. It'll enable us to look at the relative differences in different kinds of solutions that we might come up with to tackle climate change and show the relative effectiveness of one solution against another. But it's a breakthrough in a easy to use model that can give you answers very quickly. So I want to just mention quickly how I became an engaged citizen on this. I've been a sport diver, scuba diver since I was a teenager. 50 years later, half the coral reefs are dead in the world, and some of those were 2,000 years old. There's two main problems that are harming the reefs. That is the acidity of the water from all the carbon pollution that we put in the atmosphere, and the water temperature, which causes the reefs to expel their algae, which is a food source. Reefs are very important. They're cornerstone ecology. They're a cornerstone in ocean ecology. A quarter of the species, ocean's diversity, and a quarter of the species are dependent on the reef. And there's about 1 billion people that get some of their food source, daily protein from the ocean. Projections are that in the next 30 years, all the rest of the reefs may disappear if we don't do something. So this is important for us to, just one of the reasons it's important for us to act on climate change. Relative to public health, I would point as a resource the audience to the 4th National Climate Assessment, which came out in 2018, and a booklet that came out related to the climate assessment in 2016 on health. The 5th National Climate Assessment just came out. It's only available in draft form, and it will build on this. But some of the things that we would see in the climate assessment talk about, when we get hotter temperatures from climate change, we have more bad air days. And when the temperature is hotter and we get sunlight mixing with auto exhaust and industrial fumes, we get the ground level ozone. And ground level ozone is a problem for the more than 35 million Americans that have some kind of chronic lung disease, typically asthma or COPD. These bad air days can send them to the hospital. We also see with climate change that we have hotter temperatures delivering longer fire seasons. Smoke from the fires travels maybe more than 1,000 miles. And this is also hard on people that have problems with lung disease. It can also shorten lives. And it's a problem for healthy people, quite frankly, as well. We also see, because of climate change and temperature increase, we've got tens of thousands of premature heat-related deaths. It was just a year before last when we had 600 deaths in British Columbia because of a heat dome, long-term, very high temperatures in an area that doesn't usually get those. Places that don't usually have air conditioning because they don't need it are now suddenly needing it. And of course, in urban areas and underserved areas, they may not have air conditioning either, contributing to the problem. With climate change comes extreme weather events, storms. We're getting stronger hurricanes. We're getting more extreme rainfall events, the related flooding from that. Just in tropical storm, there was 3 tropical storms in 2017 where we had over 3,100 people die from that. And we have also the problem with warming temperature when you combine it with nutrient runoff from agriculture, like in factory farms. We get algae blooms in lakes and even in the Great Lakes. So the algae blooms are a function of the phosphorus in the water and nutrients, the warmer water temperatures and sunlight that can create toxic algae blooms like one we experienced in Toledo. I was there in 2014 when we lost our water supply for 3 days from the Great Lakes. And these types of events can become more frequent. So we can see mental health problems as a result of exposure to, as a consequence of some of these weather disasters, but also we see more climate change anxiety, especially at universities, with students having problems just mentally trying to cope with what they're seeing and kind of the doomism that results from that. So with warmer weather moving northward from the south to more northern climes, we also see vector-borne diseases increasing. From mosquitoes, we're seeing more instances of malaria and dengue in Florida, and we see more tick-borne diseases like Lyme disease. This is just a slide from the CDC on the reported instances of Lyme disease in 2001 versus 2018. So we're seeing an increase in these types of tick-borne diseases, and that's problematic. As another resource, in addition to the National Climate Assessment, I'd point you to the CDC. This is a slide, a graphic that the CCD generates. If you Google CCD and climate change and health effects, you'll see this slide, and it talks about the basic things that are happening in climate change and the results of those in general, and then in specifics, what some of the problems are with this. So, for instance, if you look at warmer weather and changes in the vector ecology, we start to see chikungunya, West Nile virus, some of the other diseases that are problematic and growing because of the warmer weather moving north, for instance. So this is a good resource for anyone who's in public health and just wants to see the high level, what some of the big issues are related to climate change with public health. Just to spend a moment to level set the audience on climate change root causes. You know, we have a natural greenhouse effect, which is really a very good thing. We've got some water vapor, and we've got carbon dioxide and methane in the upper atmosphere naturally occurring, allows the sun's energy in, the earth heats up, radiates heat out. Some of it's trapped. Very good thing. The temperature of the earth would be 60 degrees colder and barely able to sustain life without that natural greenhouse effect. But over the last 175 years, through our industrial processes, growing industrialized agriculture, how we generate power, our transportation, and deforestation. These are issues that have just added a lot more carbon dioxide and greenhouse gases to the atmosphere, 50% more than any other time in 800,000 years. So these premier scientific organizations in the upper left-hand corner, NASA, NOAA, many that you've heard of, and a dozen more that you haven't heard of, really they're saying that this is the cause, the most significant driver of the climate change that we're experiencing. It's not volcanoes, it's not solar flares, it's not earth wobble, it's not some kind of naturally occurring cycle. Now, this is the consensus science. I'm not here today to defend the consensus science. That's outside the scope of this presentation. But and there may be some people that are a little skeptical of this in the audience. That's okay. You're not the only one. But this is the consensus science. The vast majority of peer-reviewed climate scientists would subscribe to this as the major driver of climate change. And the results of that is, since the beginning of the last century, in the year 1900, we see the annual average global temperature increasing to about 1.8 degrees Fahrenheit, 1 degree centigrade. And the cause, where is all these greenhouse gases coming from, and when did they get there? Now, this slide is kind of important when we start brainstorming root causes or solutions to climate change. This can give us some clues. And what we see is nominal increase in greenhouse gases, and at the turn of the last century starts to grow. By World War II, they are really taking off. And in this brown and grayish area, that's from carbon emissions from burning fossil fuels. In green, it's from land use changes. In blue is methane release, and this is released from landfills. It's also from agriculture and also from industrial processes, mining, fracking, these types of activities. In purple, we have nitrous oxide, and in that little gold strip is F gases. Those are refrigerants. The nitrous oxides are from interaction of fertilizers with the soil. But over here on the left-hand side, notice that this growth is now at approximately 60 gigatons, 60 billion tons of carbon emissions every year from this variety of sources. So when we start to think about, well, what should we do about it? Well, this might be a good go-to chart. And by the way, as we're going through this presentation, pop your first name and any ideas that you have about what we should do to address climate change, and we'll model them on the simulator later on. And as the ideas come to you, go ahead and log them. But this is not a future conducive to prosperity. You know, we're seeing it now. You've got more fires. You've got these stronger storms, stronger hurricanes, more extreme weather events, longer droughts. These are all things that there's real costs to. And what we're going to try to do today is, you know, there's about a dozen worldwide well-respected supercomputer climate simulators out there. Most of them would say by the year 2100, you would find these simulators projecting anywhere from 3 degrees centigrade to 4.5 degrees centigrade warmer temperatures than the turn of the last century. Our simulator that we're working on today would put that number at 3.6 degrees. That's 6.5 degrees Fahrenheit. Now that might not sound like much, but it's an average global temperature. So that means it's going to be 2 degrees in some places and maybe 10 degrees in others. Also, it's going to be cooler over water and hotter over land. And by the way, we haven't had sustained average global temperatures this warm in a couple million years. So we don't want to let this happen. We're going to try to make recommended changes to pull this line down into the 1.5 to 2 degree centigrade increase, which is the target for the Paris climate agreement. And to do that, we'll have the very real economic threats that climate change poses. We will start to address some of these, but also the very human threats that mass migration being one of them, and all the health-related issues that come along with that, that we'll be addressing when we start to model some of the ideas that we're going to brainstorm together. Now, we were talking about the En-ROADS Climate Simulator from one of our premier engineering schools, MIT and Sloan. And what we will see in this climate simulator is we have all this excellent information loaded into the model from the IPCC, the International Panel on Climate Change, from the International Energy Agency, and from the United Nations and the World Bank. But it's not just a econometric model that looks at population projections and gross national product and the energy intensity and carbon intensity to produce that GDP. It also takes into consideration land use patterns and technology trends and energy trends and costs, agricultural inputs. This is a very powerful model, and it is calibrated to these half a dozen internationally recognized climate simulators. So we will be asking you to think about, well, now, what actions have you seen that have been practice by organizations that you're involved in, or your school, or your company? Or what have you seen states do that you think would be something that would be useful for the whole world to do? Or what have you seen other countries do? Or start thinking about, what do you think we could do that would be beneficial if the whole world did to try to get our hands around climate change? Think about that while I'm pulling up the climate model. Feel free to stick your first name and any ideas that you have in the chat. And we're going to ask you to put your United Nations hat on, because as part of this simulator exercise, we're going to assume that your voice is so well respected that the whole world is going to do what you suggest. And then we'll see if we can get the that end of century temperature down to the Paris targets. So while we do that, let me stop share, and I will pull up that climate simulator, and we'll walk you through to see how that works. Can we see the climate simulator up on the screen?
Not yet.
Not yet. Okay, hang on, and let me share screen again and get that simulator up there. There we go. You should be able to see it now. Can you?
Yep, it's up.
Okay. So here's how the simulator works. So in this upper left-hand corner, we have projections of primary energy usage. So here we are in 2020, if you can see my arrow, and through to the year 2100. In brown is coal usage, in red is oil projected usage, blue is natural gas, and you can see in 2020, the world is just starting to get on to solar and wind. And you see that growing through the end of the century. Let me make this a little bit larger to make it easier to see. In pink, we have bioenergy, and that little blue sliver is nuclear. And you can see that that's not growing very much. So if we burn all of that energy, use all of those sources to power the future, we see here in our net greenhouse gas emissions, we've got in 2020, there's our almost 60 gigatons of equivalent carbon emissions into the atmosphere. And you see that growing every year up to 2100, where it's almost 90 gigatons every year, compounding the problem. So, and then the result of all those emissions is the main driver of this 3.6 temperature in the upper right-hand corner. So manage your gallery if you're on share so that you can see that 3.6 degree temperature, because we're going to see how we can pull that down to between 1.5 and 2 degrees centigrade. So here's how it works. Here's some of the things that we can take action on. We have a couple of tools in our toolbox. When we don't want something, if we don't like something and we want to use less of it, we can tax it or we can put a fee on it. For instance, coal, oil, or natural gas, we could put a fee on that and make it more expensive. When it's more expensive, we'll use less of it. Likewise, with things that we want to use more of, we can put incentives to use it or subsidies like renewable energy, wind and solar, geothermal, or nuclear energy. Even though waste is controversial, it is a carbon-free source of energy. Or we can develop some kind of new zero carbon energy like nuclear fusion or thorium fission. We can decide whether we like bioenergy or not, that pink line in there. Do we want to promote it or do we want to discourage it? Carbon pricing is another way to discourage coal, oil, and natural gas. You don't put a tax on the product, you put a fee on the emissions of the products that are burned on the coal, oil, or natural gas companies. Transportation is a huge sector where we put a lot of greenhouse gases in the atmosphere. We can try to be more energy efficient, like the CAFE standards that we have on automobiles, or we can electrify cars, buses, railroads, or we can eventually electrify air travel and shipping. Building and industry is another huge area of emissions. We can work on energy efficiency there, or we can electrify. We can tinker with population and economic growth. Also, we can try to slow down deforestation. We saw that changing land was a contributing factor. On the methane side and other gases, we can try to reduce emissions in agriculture or in industry of methane and other greenhouse gases. Likewise, we can plant trees like President Trump's Trillion Tree Program, or we can try to remove carbon through technology. Now, a natural way to remove carbon might be regenerative agriculture, where we're locking more carbon into the soil. Or now we're starting to develop technology to pull carbon right out of the air, like a dehumidifier pulls moisture out of the air. There's machinery that are being developed and prototype that can pull carbon out of the air, and the carbon can be heated up and transported underground. So let's work together now and start to see where we can take some actions and start to bring this down. Let me give you an example. I want you to watch this blue line in this net greenhouse gas emissions chart as we make a couple of random sorts of actions here. And you start to see that line coming down. And what that means is we're starting to change our energy mix here. And that's resulting in lower carbon emissions, and that's bringing this temperature down at the end of the day. So these are this is an example of what we can do, and we'll be moving these levers based on your suggestions, and we'll see which ones have significant impact on the end of century temperature. And some we'll find maybe are more impactful than others. So we have, Al, do we have anything in the chat yet on any suggestions? You're muted, Al. Oops, you're muted there.
Nothing yet, Andy.
Okay, so maybe we would have some volunteers in the that are online. Just unmute yourself and give us a suggestion of what you think the world would benefit from in terms of taking an action on climate. Don't be shy. Go ahead.
Andy, one person wants to see how economic growth affects the results.
Economic growth. Okay. Economic growth is a tricky one because we can slow down the economy. Projected growth long-term, 1.5%. Projected growth near term, 2.5%. And the question would be, if we slow down economic growth, go ahead and unmute. And what do you think, the person that made that suggestion, what do you think that'll do to the end of century temperature? What kind of an impact do you think it'll be? And how much do you think we should slow down the growth?
Hi. I feel like if there's economic growth, we're producing more. So maybe in a bad way. So I feel like it's gonna go up.
Yeah. So if we slow down economic growth, that should bring that temperature down. Do you think it'll bring it down a lot, or do you think it'll bring it down a little?
Slower growth.
Okay.
I think it'll be like 3.
Okay, let's take that down from 1.5 to 1.0. And that did bring it down. The long-term growth dropped, and that's beneficial. So that's a good job. It didn't quite get us to 3, but it did slow down the greenhouse gas emissions, the amount of energy. Let's play it back and just see what that did here. See how our energy mix changed. And because we're not growing as fast, we're now using almost a third less energy of all different types. And that resulted in slowing down the temperature. Congratulations, that's a good job. Now, the tricky part of economic growth means we just put a bunch of people out of work. So that's not necessarily a good thing, but that's kind of the downside of playing with that particular lever. But congratulations, that was a good move. From a standpoint of making an impact. It's slowed down GDP, and it has caused less energy usage. Let's have another suggestion. We've only got about 18 minutes here to try to solve the problem of climate change here in a big way.
So Andy, Laura suggests hybrid vehicles.
Hybrid vehicles. Okay, sounds good. Let's electrify, and let's even. So if we electrify our auto transportation, that's going to take us a pretty significant way. That may get us about halfway or maybe 40% of the way to electrifying all transportation. And that got us down another tenth, 3.3. Beneficial, very beneficial.
Susan advocates afforestation.
Afforestation, okay. And who was that, Al, that did that?
Susan.
Would you unmute and let me know how much you think that will reduce the emissions?
I was thinking by quite a bit, hopefully. Afforestation, I'm assuming it's the increasing the planting of trees in the.
Yeah. How far do you think that'll bring this temperature down?
Probably by but not by a lot. Like
Okay.
1 or 2 more, maybe 1 degree.
1 or 2 tenths?
Yes.
Okay, let's try it. Thank you for that suggestion. Now, we're going to, now that's, afforestation is not going to affect our energy mix, but it will bring down the temperature. I'm going to change graphs here for a second. And what we'll do is make this an area graph. And what you see here in this green line, this is from land use changes. And notice that when we try to plant 1 trillion trees, notice that it starts to pull down carbon. We're actually taking carbon out of the air, and look what it did for our change. That has brought us down from, let's see here. So that's brought us down from it brought us down to 3.3, and that did get us, it didn't get us quite a full point. Notice that it gave us 1/10 of a degree Fahrenheit. Now, here's the problem. And this is something that, this is a clue for everyone on the call here. Notice when I go back to my net greenhouse gas emissions chart, the problem here is when we actually see this happening. The more we can bring this line down between 2020 and 2040, the more of an impact we will have on that end of century temperature. Now, let me go back to my area slide, and we can see when planting 1 trillion trees really gives us the benefit. The problem is that we see this happening in what year? It's really like about 2060 that it really starts helping us. Why? Because to plant 1 trillion trees, you need a land mass the size of the United States. And then you have to plant the trees after you acquire the land, and then they need 40 years to grow before they're absorbing all that carbon. So it could be a good thing to do, but it's not helping us soon enough. We need another suggestion, and we need to see if there's any suggestions that could help us in the kind of 2020 to 2040 or 50 timeframe.
So Andy, Laura suggests that her university has green fees that install energy efficient technologies in buildings, in the campus buildings.
Okay. Let's try that. Laura, unmute and tell me what do you think that'll do to our end of century temperature?
Are you being serious?
You think that'll get us? You think that'll get us to 3?
Maybe if it's done more broadly, yes.
Okay. All right. So building and industry, especially.
Fuck yourself.
There's a lot of a lot of carbon emitted in buildings, residential and commercial. And notice that you got us about 3.5 degrees there. 0.3 to 0.4 of an impact. That was a big impact. Energy efficiency in buildings. Congratulations, you got us a lot closer. Okay, we're getting closer to 2.0. Let's get to 2.0. We need another suggestion. Any other ones out there?
Adam, I see your hand is raised, but if you're not going to be respectful to others on this call, please keep your comments to yourself. You're welcome to share a helpful comment, but if it's not helpful, I will put you in the waiting room.
I just am confused right now. Like, are you not Big Mommy 64 from Tinder?
I'm sorry?
Are you not Big Mommy 64 from Tinder?
No. And if you cannot remain respectful on this
God
call.
fucking damn it.
Okay.
I'm on the wrong meeting.
Yes, good.
Okay.
Sorry about that.
It's all right. Any other suggestions? Now, let's look at our area graph and see where all these emissions, we're still seeing a lot of emissions in this gray area, which is the burning emissions from producing energy. And we know that we're producing a lot of energy with coal, oil, and natural gas. Does that give us another clue as to where we should be trying to make some suggestions?
Sussan already beat you to the punch and suggests decreasing coal usage.
Okay, let's get aggressive on coal and see. Ask that individual what she thinks that will do to that temperature, end of century temperature.
It'll lower the temperature by about maybe half a point or 1 point degrees Celsius.
Okay.
I think.
Okay, let's try it. So let's put a pretty significant hefty tax on that, and we will. It's $110 per ton of carbon emissions tax, and let's see what that's done. Let's play that back. And let's watch what that does to the mix here. So, okay, that's dropped at only 0.1, but look what it's done is it's reduced. I'm going to play that back again. It's reduced coal. It's actually grown oil a little bit and natural gas a little bit, but also our green, which is renewable energy. So, but let's go one step further. You know, if we could stop building coal plants right now, because when you build a coal plant, it's going to get used because coal is cheap. It's building the plant and paying for the plant over 30 years. It's expensive. Notice what happened when we decided we're going to stop building coal plants. So it really added another couple of 0.2 of a point here, and really got rid of coal. But we still have we still got an oil and natural gas problem. We're still burning a lot of fossil fuels. And over here in blue, don't forget about methane. We've got some issues there too. Another suggestion, we're getting closer. We still got a few minutes to try to fix this problem. See where you can get us. Any other suggestions?
Oil seems to be playing a big role, so can you try to reduce it?
Yeah, let's put a tax on oil similarly and see what that does for us. Excellent. Good suggestion. See, we're drawing down. Let's play that back and see what it does to our graphs. We're drawing down our carbon emissions here. We're drawing down oil. We've gotten to 2.6, but there's some other areas that maybe we need to tackle as well. We're getting close. We need another suggestion. What about promoting, is anybody in favor of promoting renewable energy, wind and solar? Does that seem like a good idea? And what do you think will happen if we do?
It'll lower temperature.
Yeah, it'll lower it. Let's try it. So it only lowered at 0.1. This is a model that suggests we're going to really continue to try to grow it. And we don't have very much now. It's going to take a while to grow it. But what else can we do in the short term to try to impact that climate change? We only got a 0.5 degree to go. Can we get there? Any other ideas? Has anybody tried changing their diet? Do we have any vegetarians in the audience? Yeah, we have a vegetarian. Okay, so if we could reduce methane by 20%, that's significant. If everybody was on the Lancet diet, where you had a little bit of chicken, but mostly vegetarian type protein, you'd get some energy efficiency out of it, because we wouldn't be transporting so many cows around, and you would also stop some deforestation, which you'd get a boost there. So now we're down to 2.4. We're getting closer. Any other suggestions?
I was wondering what population has to do with it. We don't want to decrease our population, but what if we are just, I don't know, it's probably in, yeah, like.
Well, yeah, population is a driver. We're projected by 2100 to have 10.4 billion people. We have 8 billion people now. What do you think that'll do to your end of century temperature?
You mean to decrease it, it's going to go down a little bit.
Yeah, just
so it'll be less congested.
Okay. Do you think it'll be a little or a lot?
Probably not a whole lot. I'm not sure.
Okay, let's take it down to 8.8 billion. And we got another 1/10 of a degree. Now, here's the problem. Here's why that didn't impact us the way that maybe some might have thought it would. So we got 8 billion people on the planet, but 2 billion of them are driving 50% of the carbon emissions. And the next 2 billion are driving 45% more. So half the world is driving 95% of the emissions. And where do you think the highest birth rates are coming from? Well, they're coming from the 5% that aren't really contributing very much to the emissions. So that's why, even though we reduced the population, we didn't get too much of a bang for our buck. But we've got just another minute or so. Let's see if there's anything that we can do to reduce emissions a little bit more. Any other suggestions?
I had a comment that said reduce oil.
Reduce oil. Okay, we kind of already reduced oil. We already did that one. But what if we reduced methane even more in industry from fracking, in agriculture? We got quite a bit of a boost out there. Let's see if that gets us to our goal. Wow. Methane is a big driver. Let's play that back. So methane, now that didn't change our energy mix, because this is methane that's being released right into the air. But it did change this greenhouse gas out here, playing that back. We got 0.3 of a degree out of it. Congratulations, you got to 2.0. And what kind of a world did you just create for us? Well, let's take a look from a health standpoint. We talked about deaths from extreme heat. Notice that we have reduced by 50% the growth in extreme heat deaths, more than 50% in Asia and in Southern Europe and South America and Australia. Let's take another look at impacts. We talked about air pollution. Look at the reduction in PM 2.5. PM 2.5 are particles that are so small that when you breathe them, they get into your lungs, and they can even get into your bloodstream and cause heart problems, but definitely cause more problems for people with COPD and asthma. Look at how that's declining by virtue of the world that you just created. Let's take a look at Another impact from crop yield loss, which impacts our ability to, sorry, I got something in the way there, that impacts our ability to produce crops. We see that corn is, we've saved 50% of yield loss on the corn, on wheat, rice, and soybeans, because the more droughts, hotter weather is going to, and more extreme weather events is impacting our crop yields. Let's see if there's any other impacts we can speak to. We can also look at ocean acidification is coming. We're reducing ocean acidification. The pH level is rising, which means it's becoming less acid, which gives the coral reefs a break. So these are all things that are a result of the world that you just created. Now, I'm going to stop share for a second. And first of all, congratulations, everybody, on that, on the benefits that happen by what you just did. But I want to just go back to the presentation for a second and talk about and ask, are there any insights before I do? Are there any insights from the exercise we just went through? Any learnings from you? Anything that surprised you about what we just did? What are your thoughts on the exercise that we just went through? Please unmute and let me know if there was any new insights that you gained. For instance, did you think it was going to be that hard to reduce the end of century temperature? Were you surprised that certain things didn't deliver more of an impact? Any thoughts on that? Anything in the chat, Al?
I find it interesting how so many things contribute to it, and then how there's so many things we need to resolve it.
Yeah. Yeah, it really took a lot of things to resolve it. And I think one of the learnings that we have is, and that becomes apparent as you do this a couple of times, is that let me just fast forward here. So one of the things that we'll see is that actions that can be implemented quickly really have a significant impact, and actions that can be taken, like coal and oil, to keep fossil fuels in the ground are very impactful. And so I want to talk about two pieces of legislation that you ought to be aware of, because these can really help address the problem. One was legislation that was being considered last year. It didn't pass, but it came very close to passing. And it's called carbon pricing. And it puts a fee. We didn't play with this lever, but we'll play with it in a minute. Coal, oil, and natural gas, you put a fee on the fossil fuel companies when they extract it from the ground. It can be a small fee, like $15 a ton. We put $100 a ton on there, but even a small fee that increases every year, this would be like the equivalent of 15 cents on a gallon of gas. The Treasury Department collects it, and then it goes back to every household in the form of a dividend check, and that helps it helps fossil fuels reflect their true cost, because they never pay a nickel for the 4-foot rainstorms in Houston or the fires out west, that never hits their bottom line. So we're actually starting to price fossil fuels more fairly if we put a carbon fee on it, and especially if we give that fee back to households to offset any price increases that they might put in there. But because fossil fuels also have been so heavily subsidized for so long, it levels the playing field for clean energy to compete. And just to give you an idea, a family of 4, 2 adults, 2 kids, that would be almost $700 a year in those periodic rebate checks coming back to a household. It'd be $2,000 in year 5 and $3,000 in year 10. So now households could say, hey, do I still want to just be using that money to pay for more expensive fossil fuels, or do I want to buy cheaper clean energy and pocket the difference on there? So that's how we can really engineer change. And we can do that with a carbon pricing. We call it cash back carbon pricing. That can be done without job loss, without harming the economy, and by keeping us internationally competitive with border adjustments. Let me just stop share and show you, if we'd have come right out of the chute with carbon pricing, what that would have done for us from a standpoint of the climate simulator. So here we have, let me get back into Zoom here. Okay. Can you see the climate simulator up now?
Yes.
Okay, so now let's go to one. I have programmed this one. Let me go back and let's see. Let's take that back to 0. Now, here's our starting point. And here I've programmed in that piece of legislation. Right out of the chute, we made one move, and that one move is to take this carbon pricing lever and program it for that piece of legislation. We've moved one lever and we got to 2.5 with one move. And now if we do something to address carbon emissions and energy efficiency in buildings, maybe electrification in buildings, we're at 2.0 in just 4 moves on the board. So that just gives you an example of how some levers are a lot more impactful, because what we did was we addressed coal, oil, and natural gas all in one move. And because you can put that legislation in place tomorrow and it'll start benefiting you, that really impacted the emissions on that. Now let's go back and wrap up with some of our slides here. So let's just make that a little bit bigger. So I also want to talk to you about the Inflation Reduction Act. This was legislation that did pass, unlike the last piece of legislation we just talked about. And this is money that is available to you. This was passed. This is the biggest climate bill in U.S. history. It devoted $15 billion in electric vehicle tax credits, $5 billion for forestry, climate smart agriculture, $10 billion in consumer home energy rebates, and it can also address biofuel, hydrogen, nuclear investments, and also tax credits for solar, wind, and batteries, also carbon sequestration. So I'm going to give you a resource that everybody can participate. There's up to $14,000 per household to buy more energy efficient furnaces, heat pumps, clothes dryers, electric stoves. All of these funds are available. There's more depending on your income level, but tax credits are available to everybody on this. And that will make things, and there's a calculator that you can calculate how much money is available to you by just putting some generic information about your household income, whether you're a homeowner and whether you file jointly or not. You don't have to put any confidential information in there. And I'm going to send you, I'm going to put a link to where you can find out these resources. Now, if we'd have modeled this Inflation Reduction Act, we would have also seen, now we had to move a lot of levers, but we would be at about 2.6 degrees coming out of the chute. And then we could do some more things that we wanted to get there. But what I want you to know is that you should feel hopeful that you should feel hopeful that you can, on the current path that we're on in terms of trying to reduce our emissions by 50% by 2030, which is what President Biden wants to do. We're on a track to get to 28%. With the Inflation Reduction Act, we can get to 40 and we can get to 52 with carbon pricing on there. So you should feel hopeful. You should walk away from this meeting understanding that greenhouse gas emissions is enemy number one, and that we need to address misinformation. We need to not succumb to doomism, because you have just shown us that we can get to where we need to go. We need to overcome forces of inertia, and we need to stay focused on the problem. And what you can do, there's certain lifestyle changes that you can make that'll help, but the big win is when you are changing the system. And that means you are going to be engaging as an advocate. You're going to be talking about it with friends. You're going to be advocating for it by calling or writing Congress. And I'll also tell you where and how you can do that. We need everybody all in on that. We've got to, when Al and I go and talk to congressional representatives, they want to know that they're hearing from it from their constituents. That's you, and you can make a difference. And you can make a difference by joining groups like Citizens Climate Lobby or other groups like the Sierra Club. We did 920 meetings with Congress, 225,000 contacts through email and phone, 2,000 letters to the editor. That's how we got the Inflation Reduction Act passed. And and Citizens Climate Lobby, by the way, we are focused on carbon pricing, but also building electrification, getting permitting done so that we can build more transmission lines to get power to city centers and healthy forests. So that's kind of what we're about. And I'd just like to open the discussion up to who has ideas, other ideas on what we can do. And any questions? Okay, let me give you a call back in 5 minutes. Sorry. Yeah. So let's stop share and talk about what we can do. By the way, I'm going to leave this up. This link, tinyurl.com, CCL Climate Smart, this has information for you on how to write Congress about forests and permitting and carbon pricing, but also that household calculator to see how much of that $14,000 your household is eligible for. It also has information on Citizens Climate Lobby and a host of other information on there. If you go to tinyurl.com/CCL Climate Smart. And also you can email me at any time you want to ask any questions that you might have. But I would just like to ask, what are your ideas? What are your thoughts on what you can do leaving this meeting, on any new insights that you have? Because this is a problem for all of us. It can't just be Al and me that are trying to make noise about it. We all have to do that. Any thoughts on that, just as we wrap up our discussion on that, or any questions that you have on what we've just talked about? I think it's important that we exercise what was important, because sometimes it's easy to feel overwhelmed, like we can't make a difference. Very good. That is a really important realization. This can be overwhelming, but you just demonstrated that we can make this work. So we need to have a positive attitude about this, and that we can. There's only so much we can do, and we should be doing it. But where we're really going to get the change is by getting Congress to act, and there's where we can make the bigger difference. Now, Al, what is your thoughts on all of this? Al has spent his entire career at the prestigious National Labs, Argonne National Labs. Al, what is your thoughts on this?
Well, I think one of the people who attended this talked about educating others. You know, that the whole business about Congress responding to what people think are the most important things. So if enough people could just say what they tell each other, that climate is important, but say it to the representative, that would move the whole attention in Congress away from all sorts of a zillion different things to something that really is important for our kids in their future. And those kids right now can't vote. So it's really for us to do something. And it's important to educate others and get people to express themselves to their representatives.
Very good, Al. Thank you for that. Yeah, I might add, and the more specific you can be when you tell your congressional representative, like, hey, you know, we need to plant more trees, or, you know, we need to grow green carbon-free power sources faster, or we should have carbon pricing so that the fossil fuel companies are paying their fair share, pricing their products fairly. The more specific you can be, that'll help too. And by the way, and a lot of times when you join an advocacy organization like CCL, otherwise, they'll send you a once a month suggestion for who to write, what to say. They try to make it easy for you, so that even if you only got 3 minutes a month, you can still make a difference and make a targeted difference. Any other questions while you've got Al and me on the line to kind of answer any questions that might have come up during the presentation, or any other questions that you've got about climate that we might be able to answer? Well, I want to thank everybody, and Al, thank you, and Alicia, thank you for having us. Great suggestions. You got us there, and maybe there's some levers that could have got us there a little quicker, but you got us there. And the levers that you picked, by the way, are still important levers, even though they're not high leverage. It's still important to plant trees. It's still important to maybe keep an eye on population growth. It's important to electrify transportation. These are important levers to do. So hopefully, as you move through your careers, especially in public health, we got to keep the climate in mind, because if we don't fix that, a lot of the other things that we try to do to make the world better will just not make as much difference. Thanks everybody for your attention today. I know we threw a lot of information at you, and it's a lot to digest. But we'll leave that one screen up if you want to grab that information off of there to access those resources. I'll leave that up for a moment, and thank everybody again for a great round of input.
Yeah, thank you so much, Al and Andy, for such an informative session and activity. I hope everybody on the call enjoyed that. I did want to apologize if there was any offense taken to our ill-intended guests that we were able to get out of our Zoom line, but I did want to apologize to everyone regarding that as well. But going back to the good stuff, thank you all for coming. Thank you for sharing all this wonderful information. If anyone needs to get connected to any of this information or to Andy, please feel free to reach out to myself or anyone on my team, and we'd be happy to get you connected to any of the information that's been shared today.
Thanks, everybody.
Thank you, guys. Take care. All righty. So now we can move on to our next part of our agenda. And it looks like we do have our wonderful closing remarks speaker on with us as well. Welcome, Dean. Okay, Dean Tom, I don't know how to pronounce your last name, so I apologize in advance. But I'll go ahead and pass the baton to you to go ahead and introduce yourself and close us off on this wonderful day.
Exactly. Well, I'm probably in the same boat because I'm not sure I know exactly how to pronounce your name, but Alicia, thank you so much. My name is Tom Fillion. I'm the new Dean of the Goodwin College of Education, and I'm just real honored to be here. Very grateful for the invitation to close this wonderful conference. Want to start off, of course, by saying thank you to all the various people involved in this endeavor. This is my first time attending, and I just got a little piece of it. But I'm really already looking forward to the 7th annual conference, which I hope will take place next year. Thank you to all the participants, all of you who attended, all the various panelists, and finally the organizers of this project. This is not easy, and even though I'm sure it was easier because of the motivation to be back on campus and doing on-campus activities, I know whenever you put together a hybrid conference, it's just going to be a bit complicated. So congratulations to everyone involved in this project. As closing remarks, I think I'll just leave you with 3 key ideas, which I found myself thinking about, especially as I listened to and engaged in the last presentation. One, I'm just really hugely grateful for the emphasis on hope. I agree with at least one participant in this conference who talked about how, sometimes you look at these big issues, representation in the sciences, climate change, and it feels all just overwhelming. It feels very difficult, and it's hard to imagine the pathway to success. But I really appreciate all of the different comments that I'm sure were made throughout the conference about how there are actually some very concrete, not that difficult things that we can do to ensure that we have better communities in the science communities, more equity in those communities, better climates, better environments for all of us living on this planet. So thank you for the hope that was provided through this conference. I also really appreciate this idea of balance. I was just thinking about it as I listened to the last conference presentation here, thinking about, so what is the connection actually between women in science and climate change? And to me, this idea of balance came across, that it's really about creating communities where we have greater equity, we have greater satisfaction, we have greater sense of collaboration and participation, more inclusivity within our environments. And that means, creating more equity and balance, looking globally in terms of the impacts of gas emissions on our planet. It means looking at our science communities and thinking about how we can support greater equity and representation among women in the sciences. So this idea of balance is something that I take away from today's conversation. And then the last idea I would leave with all of you is the importance of connections. I was really struck in the last presentation on the way, of course, everything that we do, all the little steps that we take personally to support the achievement of a better planet, a better world, a better community here at NEIU and elsewhere, all of that is hugely important, but it has to be tied to active engagement at the policy level. And it's where we work in communion with others, in collaboration with others, to try to affect larger political change, social change, that I think we really begin to kind of achieve some of the goals that we have for having a better community and a better planet. So I leave here with that idea as well, even more committed to this idea of not only doing things in my own personal circumstances, in my own work, in my own position, my own job, but also thinking about how I can work with others more globally. I hope you're walking away with some great ideas and concepts and actions that you want to take in the future. I look forward to engaging with some of you about those ideas, and then those I don't, hopefully we'll get a chance to connect all again next year. So thank you to everyone involved. Really appreciate it. And everyone have a great weekend.
Thank you so much. Yes. And with that, thank you, everybody. We will let you have a wonderful rest of your day and have a happy weekend. Take care, everyone.
Thank you. Thank you so much. Thank you, Alicia.